Credible research shows that wireless increases cancer risk and damages young brains. Sleep. MIT published a study showing that wireless exposure resulted in decreased time in the deepest sleep stages, and the scientists conclude components of sleep believed to be important for recovery of daily wear and tear are adversely affected by wireless signals. Why else would France just pass a national, first-of-its-kind bill banning Wi-Fi in schools? Why else would private schools across the country be turning off the routers? Boston, Portland, Minneapolis. Why would so many respected Yale and Harvard scientists be calling for immediate action? And why would researchers be saying that the evidence has increased to where wireless is a proven carcinogen? Now let's say I'm at the grocery store and I have the choice of two apples. One apple emits a radiation that some say is possibly carcinogenic, other scientists say definitely is, and they're studying it in rats. The government says it's legal. Should I feed that to my child? Now this apple has no radiation, but it has a wire, a little inconvenient. It means you have to sit at the table to eat it, or else you might trip over the wire. I know my kids will think this apple is prettier because they can munch and crunch all across the house. What do? As adults, we worked hard caring for our kids, and we want our children and plan on seeing them to get to college. Plus, wireless is linked to sperm damage, and I plan on having healthy grandchildren. So yes, there's a wire on the safe apple. But when you get cancer, there are far more wires. IVs, chemo ports, wires into holes you didn't know you had. It's common sense to choose safe technology. Wired, not wireless. As parents, we support the precautionary principle. If we don't know that something is safe, and this wireless radiation has a rap sheet a mile long, then we shouldn't be exposing our children to it. You can't see it, touch it, or taste it, but it's here. The Wi-Fi routers in this room, for example, and I was measuring over there, they were in the thousands. I have a meter, so I can show you. Microwatts per meter squared. And if I had a Chromebook, like the kids do in schools, it would be at least 35,000, like at Bells Mills Elementary, where radiation studies were done. The level in my house used to be in the thousands too, and then I turned off my routers, I connected with wires. Every one of you can do this in your own home, and schools can do it in classrooms. Parents have formed a coalition called Safe Tech for Schools Maryland. Radiation measurements from MCPS are posted on our blog at safetechforschoolsmaryland.blogspot.com. Every school district has a responsibility to support safe and healthy schools for our children. There is no reason to wait. The research shows your risk increases for every hour you are exposed to wireless. Yes, it's everywhere, and yes, we can do something about it. Our children's future requires your due diligence. Thank you.
All kids have the right to go to school in a safe and healthy environment and be given the best chance to succeed. The new technology program at MCPS puts an unprecedented amount of radiation in the classrooms. This is not an issue over whether a child should have a laptop or internet access in the classroom. This is about whether the internet should be accessed safely through greener and more reliable wired technology or with Wi-Fi, which uses radiation. MCPS puts the children's health at risk with industrial-strength routers that are too strong, too many, and left on all day. For example, at Bells Mill Elementary School, there are 30 access points, or routers. Some of the children are sitting all day in a hot spot right above or right below an access point, where the radiation is strongest. MCPS measured the radiation at my child's school, Bells Mill. I was shocked to learn how high the level was with just one Chromebook on. The norm is for every child in the classroom to use a laptop, and the more devices, the more radiation. This radiation travels through ceilings, floors, walls, and of course the children's bodies. MCPS believes that the Wi-Fi radiation is not enough to cause harm, but over 5,000 non-industry-backed studies demonstrate harm at levels that are much lower than what is found at schools with Wi-Fi. The FCC admits there is no federally developed national standard for safe levels of exposure to radio frequency energy, but we do know that at very low levels, hundreds of thousands of times lower than the 1996 guidelines, the FCC does refer to, there is cell damage, inflammation, which lowers immunity, and penetration of the brain barrier, which is supposed to prevent toxins and pathogens from reaching the brain and keep our kids safe. This is why the Los Angeles Unified School District, LAUSD, a district of over 660,000 students acknowledging potential harm decided not to wait for the FCC to develop standards that keep the children safe. They have set the threshold 10,000 times lower. I believe, like LAUSD, if there's evidence of harm, we at MCPS must act and take all necessary precautions to protect the children and staff. The findings at Bells Mill show levels at thousands of times higher than the radiation levels allowable by LAUSD and far higher than what leading experts in the field consider safe. The American Academy of Pediatrics has stated that the current guidelines needs to be revised and more accurately reflect the situation we have today if we are to account for the unique vulnerability of children and help them live long and healthy lives. When there's evidence of headaches, brain fog, lethargy, behavioral, neurological, reproductive issues, disease, and possibly cancer, why are we gambling with our children's health? There are solutions, and we can reduce the risk. Thank you so much.
Our next speaker